When you have finished your tumor check, return to a right side short axis view of the left ventricle. The transducer is still perpendicular to the right thorax. Rotate the transducer 90 degrees clockwise. The transducer index will now be facing away from you and toward the patient's vertebrae, or dorsally. Using the clock face analogy, the transducer index will be pointing between 11 o'clock and noon. Shift your grip on the transducer so your thumb is opposite the transducer index. To prevent image drift caused by unintentional transducer movement, continue to use your index finger to anchor your hand to the patient's thorax, and anchor the transducer to your index finger. The elbow of the transducer arm is still anchored to the rubber mat. You should now have a right side, long axis, 4-chamber view of the heart. The transducer is touching the patient's right lateral thorax, so the near field of the ultrasound screen is the patient's right side, and the far field is the patient's left side. The index indicator is pointing toward the heart base, so the right side of the screen is the heart base, and the left side of the screen is the apex of the heart. Depending on the position of the heart in the patient's thorax, the index indicator may be pointing cranially, a cranial oblique, or dorsally. So the right side of the ultrasound screen could be cranial, cranial oblique, or dorsal, and the left side of the screen is the opposite direction. In the right side long axis 4-chamber view of the heart, you see the anechoic chambers of the right ventricle and the left ventricle. The endocardium is the hyperechoic inner lining of the ventricular chambers. The pericardium is the hyperechoic outer fibrous covering of the heart. The right ventricular free wall is in the near field. The interventricular septum separates the right and left ventricles. The left ventricular free wall is in the far field. The right ventricular free wall is in the near field and the closest structure to the transducer. The right ventricular free wall is about half the thickness of the interventricular septum. The right ventricle is about half the size of the left ventricle. The right atrium is in the near field and to the right side of the screen. The left atrium is below the right atrium and 2 to 4 millimeters larger than the right atrium. The two atria are separated by a flat atrial septum. The tricuspid valve is in the near field. The mitral valve is in the far field. The anterior mitral valve leaflet is the one closest to the transducer, and the posterior leaflet is the one further away from the transducer. If you fan or slide a little caudally, you see the posterior papillary muscle of the left ventricle. And the chordae tendineae of the posterior mitral valve leaflet. If you fan or slide a little cranially, you see the anterior papillary muscle of the left ventricle, the chordae tendineae of the anterior mitral valve leaflet, the left ventricular outflow tract, the aortic valves, and the aorta. This is the right side long axis 5-chamber view of the heart. In the right side short axis view of the left ventricle, the anterior papillary muscle is to the right side of the screen, and the posterior papillary muscle is to the left side of the screen. When you rotate to a right side long axis 4-chamber view, the ultrasound beam will split the left ventricle in half between the papillary muscles, and you do not see either one. This is why you must fan or slide caudally or cranially to see the papillary muscles in the right side long axis view. From the right side long axis 4-chamber view, you can freeze and use Cinematic Loop to select the best image. Ideally, you measure the right and left atrium during left ventricular systole. the tricuspid and mitral valves will be closed and the atria will fill to maximum capacity. Measure the right atrium from the free wall to the atrial septum at its widest point. Then measure the left atrium from the atrial septum to the left atrial free wall. Save this image and measurement. The right atrium is usually 2 to 4 millimeters smaller than the left atrium in this view. If both atria are equal in size, the right atrium is probably enlarged. Use color flow Doppler to check for a tricuspid insufficiency. If the left atrium is markedly larger than the right, there is probably a mitral insufficiency. Use color flow Doppler to look for the mitral insufficiency. If there is no obvious mitral insufficiency, the patient may have an aortic or subaortic stenosis. You will find that this long axis view is more likely to show an early left atrial enlargement than the aorta to left atrial view from the right side short axis. Abnormalities noted in the right side short axis view should be confirmed in the right side long axis view. This dog has tricuspid prolapse. The right ventricular free wall is thicker than the septum. The right ventricle is larger than the left ventricle. The right atrium is larger than the left atrium. The right atrium bulges the interatrial septum into the left atrium. This dog with pericardial effusion has a mass in the right atrial free wall. This cat has a vegetative lesion on the aortic valve. This 7-year-old boxer has a large mass in the left atrium. This dog with severe pericardial effusion has cardiac tamponade. Note how the right atrium and right ventricle collapse and contribute to right-sided congestive heart failure. This dog has a ruptured chordae tendineae and a flail anterior mitral leaflet. This cat has severe left atrial enlargement and a smoke thrombus in the left atrium.